My name is Donna Frederick, and I'm a Durham resident. I'm a small business, and I run a retail shop in Durham, and it's the Playhouse Toy Store. We're a retail specialty toy store. We deal mostly with babies. Our business has been established for 22 years. We have one full-time employee. We've had up to 6 full-time employees. We've had to, because of the economic condition, we had to let people go. Also, the rising cost of number one, health insurance plays an impact on, the benefits we can give employees that do work for us. I'm insured right now through Blue Cross Blue Shield of Durham, North Carolina. I think the options that are available make it very expensive for small businesses. I mean, 1 or 2 people in a business to, have health insurance. With small business, we pay a higher premium, and we get the least amount of benefits out of that premium. I mean, a lot of the insurance companies have the same rate whether you're making, $60,000 or you're making $600,000, and it's not fair for someone who's, the equation is not the same. I think anybody working for someone does need health care. I mean, it just sort of goes hand in hand. I mean, they're doing the job. Eventually someone will get sick, injured. It shouldn't be such a strain to provide these, but unfortunately the price has driven it that way. Basically, you're paying a premium, you're paying a copay, and it depends on how much service that your copay is. There's really not a lot of choice. There needs to be more education, and again, I'm back to community-based centers where the wait isn't, hours and hours. You can go in and be seen. You might have staffed with people who are going to be there for a long period of time. There's not a lot of rotation. It's hard for doctors to really have one-on-one kind of information when they're changing locations, 4 and 5 times. I mean, right now, most people seek medical care for emergencies, and they end up, unfortunately, in an emergency room scenario to get a routine treatment. At a clinic, it might be a little cheaper, but the hospital setting charges you more because you're in a hospital. I think more of the preventive care would be great, but even with preventive care now, they have a cap on how much is quote-unquote preventable. You have a certain dollar amount. After you reach that dollar amount, it's no longer preventable care. We do have some options. I think they need to be more of them. I think community-based centers would be great, and more of them, and more accessible, especially to places out of the inner city. Some of our rural areas are suffering terribly because they cannot access or don't even have clinics to get to. Personal, I had to have an MRI done, and it was covered under my insurance, but the premium that I had to pay after my co-payment was just, was just a lot of money. So while a lot of people might benefit from all these technology things they have, their insurance won't pay for it. I think insurance companies need a overhaul. That's my opinion. I think in the beginning they might have had a good idea, but I think it's been run amok. I think pharmaceuticals got involved in there some kind of way. I just think they need an overhaul. They really need a fine-tooth combing through and really do some house cleaning.